Okay, the next item of business is a statement by Neil Gray on implementing the medication-assisted treatment standards. The Cabinet Secretary will take questions at the end of the statement, therefore there should be no interruptions or interventions. I call on the Cabinet Secretary. Around 10 minutes, please.
Thank you, Presiding Officer. I'd like to take this opportunity to update Parliament on progress regarding the implementation of the medication-assisted treatment standards, MAT standards, along with the wider work of the National Mission. First, I would like to acknowledge the suspected drug death figures published as part of Public Health Scotland's latest radar surveillance report, which highlighted that there were 215 suspected drug deaths between September and November 2024. This 10% reduction on the previous quarter is welcome. However, the number of drug deaths remain much too high and serves as a stark reminder of the work which remains to be done. Behind every statistic is a person and a life lost needlessly. They are people who leave behind grieving loved ones, who bear these tragic losses, and to them I offer my sincerest condolences. That is why the work of the National Mission is so important. The clear-cut aim of the National Mission is to reduce drug deaths and improve lives through a holistic approach. The statistics on harms caused by alcohol are also alarming, and we are committed to tackling these in conjunction with drug harms. Before I move on, I would like also to acknowledge the recent report of the People's Panel on drug-related harms. We are considering its findings, and I look forward to providing evidence to the cross-committee and set out our response later this month. The MAT standards are a key element of our national mission. They take an evidence-based approach to enable the consistent delivery of safe, accessible and high-quality drug treatment across Scotland. In July 2024, Public Health Scotland published their third national benchmarking report. It provided an assessment of the status of implementation of the standards as of April 2024. For standards 1 to 5, 90% were assessed as fully implemented. For standards 6 to 10, 91% were assessed as partially implemented. Whilst this is positive, I am fully aware that much work is still to be done to ensure the successful implementation of all 10 standards. The benchmarking report acknowledges areas of good practice, but there is still some way to go before everyone everywhere can benefit from the same level of support. And we continue to work closely with local areas and partners to ensure measures are in place to support local implementation. More broadly, much of the work of the National Mission supports the implementation of the standards and beyond, and I will highlight a few of these areas now. MAT Standard 8 commits to improving advocacy for people who use drugs. In December, the First Minister and I had the pleasure of attending the launch of the Charter of Rights, developed by the National Collaborative and drawing on experience of those with lived and living experience of substance use. The Charter supports people affected by substance use to realise their human rights and seek to empower them to demand the care and support they need. It also provides those delivering services with a clear reminder of their duties to ensure a standard of care that reflects these rights. Taking a holistic, person-centred approach that supports improved access and empowers people to make informed choices about their care will support a human rights and human and health-based approach to the treatment of any substance. We recognise the importance of adapting services to ensure that people seeking help are able to get the right support at the right time. This is especially important in the area of mental health and substance use, where evidence suggests that needs can intersect and where to effectively treat one, we must also address the other. This is the focus of MAT Standard 9. The Government is committed to ensuring that we work across policies and portfolios to better understand common issues, how to resolve them, and we are supporting better working links between services and driving a culture of inclusivity that puts the needs of individuals at the heart of everything we do. In this vein, we commissioned Healthcare Improvement Scotland to produce an exemplar protocol on mental health and substance use, which builds on best practice from across the country and internationally. The protocol was published in September 2024 and outlines how mental health and substance use services can work better together to deliver a whole system approach. And so, building on this, we have commissioned Healthcare Improvement Scotland to support local areas to adapt this protocol to their own circumstances, ensuring workforce have the tools that they need. We also know that women who use substances often face unique gender-specific challenges when accessing treatment and support. That is why we are committed to taking a gender approach and ensuring that women can access the right services for them when they need it. This includes our work on developing a good practice guide to help local areas do more to support women affected by substance use and their babies during the perinatal period, along with efforts to upscale residential rehab services which keep women and families together. More than £5.5 million has been committed in conjunction with our Whole Family Wellbeing Fund to support the establishment of 2 houses run by Aberlour Childcare Trust, which are specifically designed to support women and their children through recovery. We last week confirmed an additional £1 million funding would be made available to support Aberlour's important work with women and children affected by drugs. And this additional funding will allow more women and infants to receive the support that they need during this crucial period. Beyond this, we will also invest a further £1.5 million in broader drug and alcohol services this financial year. The additional funding for alcohol and drug services will allow us to support even more people to achieve their own recovery. This whole family approach is not only a key focus for our approach to recovery, but a fundamental component of our commitment to keep the promise. Today, the 5th anniversary of the promise, it is important that we acknowledge the important role of early intervention and prevention in keeping families together where it is safe to do so. I recently saw for myself the impact that early intervention can have on the lives of young people when I attended the launch of the new Roots service delivered by Circle in East Lothian, one of the most impactful visits I've had the pleasure of experiencing as a minister. Roots meets young people affected by substance use where they are, providing whatever holistic support that they need. And the results speak for themselves, breaking intergenerational cycles of substance use and supporting our young people to achieve their goals. And thanks to the Whole Family Wellbeing Fund, this service is now available in 8 areas of Scotland. A core pillar of our national mission is to increase access to and the provision of residential rehabilitation. Our vision is that residential rehabilitation is available to everybody who wants it and for whom it is deemed to be clinically appropriate, at the time that they ask for it and in every part of the country. We are also committed to increasing the number of people publicly funded for their placements by 300%, with the aim of 1,000 per year by the start of 2026. A recent report published in December 2024 by Public Health Scotland concluded that we successfully achieved that target in 22-23. However, we remain ambitious to sustain and build on this success. So we have made £2 million available this year via the additional placement fund to support this endeavour. Delivering the MAT standards and advancing the broader national mission requires a skilled and resilient workforce. We're grateful to those who deliver drug and alcohol services, and we recognise that addressing current workforce challenges will not be a quick fix. In spring 2025, the Scottish Government will introduce and support the implementation of a suite of drugs and alcohol workforce publications developed in collaboration with stakeholders. These will outline the knowledge and skills required by those supporting individuals who use substances, facilitate access to a range of training opportunities, and outline guiding principles for employers to ensure consistent care and support in the workplace for individuals with lived experience. As a package, these publications will help to support every opportunity to enter, develop and sustain fulfilling careers within the drug and alcohol sector. So as we approach the final year of the National Mission on Drugs, our attention is turning to the future. Learning from our progress to date and ensuring a smooth transition to the next phase will be key. We have made significant progress in building prevention, treatment and support approaches to reduce the harms caused by substance misuse. However, reducing alcohol and drug-related deaths and wider harms remains and will remain a key priority. So it is our intention to work in a collaboration with our stakeholders and partners, including those with lived and living experience, to plan for the next steps in addressing the harms caused by drugs and alcohol in Scotland, and I look forward to progressing that engagement, including across this chamber. So moving forward, Presiding Officer, continued implementation and sustainability of the MAT standards remains a priority. We must also continue to be responsive to emerging threats and ensure that services can continue to adapt to meet these new challenges. MAT implementation should remain at the forefront of our efforts through the remainder of the mission, and these standards reinforce a rights-based approach to treatment and emphasise the importance of allowing people to make informed decisions about the types of help available to them, which is vital in delivering on the ambitions of our national mission. In that respect, I hope the Chamber will join me in supporting the efforts and actions that the MAT standards and overall national mission sets out to achieve, and I look forward to the next benchmarking report publication in the summer. And I believe if we work together, we will transform the lives of individuals and families across Scotland.
Thank you. The Cabinet Secretary will now take questions on the issues raised in his statement. I intend to allow around 20 minutes for that, after which we'll need to move on to the next item of business. And I would encourage members wishing to ask a question who haven't already done so to press the request to speak buttons. I call first Sanders Golhani.
Thank you. A declaration of interest to practising NHS GP. Cabinet Secretary, we still have the highest drug death rate in Europe. The MAT standards were announced in a fanfare in 2021, yet 4 years later, people seeking help still face unacceptable delays, workforce shortages and a postcode lottery in treatment. Community-led services continue to struggle due to our lack of sustainable funding, and the government's slow progress is costing lives. Scotland needs urgent action, not more rhetoric. And that means real investment in rehabilitation and a commitment to the Scottish Conservatives' Right to Recovery plan, ensuring everyone can get access to treatment that helps them get off drugs for good. The people of Scotland deserve better. We need measurable results. And given that the Scottish Government's latest project, the Thistle Drug Consumption Room facility, is now operational, my questions are around how the Government will evaluate whether the Thistle is a success or otherwise. So what specific, and I do say specific, criteria will be measured? Will the Cabinet Secretary commit to assessing its impact not just on users but also on the community that surrounds it? And finally, did the Scottish Government evaluate the impact of using the money invested in the Thistle against using it for community-led projects like the Roots project the Cabinet Secretary referenced in the statement?
Cabinet Secretary.
Thank you, President Officer, and I thank Sanders Golhani for his question. I recognise what he set out in the opening of his response to my statement, which was that drug-related deaths in Scotland remain far too high. I acknowledged such in my statement as well, even when responding to the latest radar figures showing a 10% reduction. I recognise that there can be fluctuation there in quarterly data, and that the reason why this statement is so important, the implementation of the MAT standards, is to reduce harm and to reduce deaths. In terms of sustainable funding, the £250 million national mission, I am confident we will achieve. That has created a significant amount of additionality across not just alcohol and drug partnerships, but also in the likes of the CORA funding that goes out to community partners. And in terms of the Thistle, I set out in questions previously to Mr Golhani and others around the aim of the pilot being to reduce drug-related harm, to reduce drug-related deaths, and to see people get access to services that otherwise they would not have approached. We can already see the evidence from those managing the Thistle that that is coming true, and I hope everybody will engage positively in this as being an additional element of our national mission, because it has to be a holistic approach. No one element is going to respond or resolve matters. In terms of residential rehab, a report from on the capacity that we have available, it shows that there has been a rise in residential rehabilitation capacity from an estimated 425 beds in 2021 to a maximum 513 in 2024. So a rise of 21%, which demonstrates our commitment to taking all possible steps to resolve this matter.
Thank you. Paul Sweeney.
Thank you, Deputy Presiding Officer. Scotland's drug death crisis is a national emergency. Lives are being unnecessarily lost every day right across the country, and we must not forget that every one of those deaths is a preventable tragedy. Whilst the 10% reduction in drug deaths from the previous quarter is a potential sign of progress, we know that there can be seasonal variations, and it is frustrating that the Minister would come to Parliament and tell us yet again that the MAT standards are not fully implemented, despite this national mission on drugs launched 4 years ago, now approaching its final year. Interventions such as the official overdose prevention pilot in the East End of Glasgow will save lives, and I had the opportunity to visit the centre recently, but it is not a silver bullet. The Government must properly support health boards to implement all of the MAT standards. I am worried that the National Mission on Drugs will likely fail, given we are now 1 year away from the end date, yet drug deaths in Scotland remain the highest in Europe, if not the developed world. So what is the Cabinet Secretary doing day to day to drive full implementation of the MAT standards across every territorial health board, cognizant of emerging risks such as the rise of synthetic opioids?
Cabinet Secretary.
I'm absolutely cognizant of the rise in synthetic opioids and the linked action around the rollout of naloxone. The naloxone programme in Scotland is so important here. But I think the action that we're taking, I think, is showing demonstrable progress in terms of the implementation of the MAT standards. I share his concern that we haven't got full implementation. I set that out in my statement, that we have got more work still to do. We continue to work with local alcohol and drug partnerships, with local health boards, to ensure that is happening. But I do see, from not just alcohol and drug partnerships, but Public Health Scotland's benchmarking report, demonstrable progress that we can build upon. And I'll keep working with health boards as well as alcohol and drug partnerships to ensure that progress is maintained.
Thank you, Claire Hawkey. To be followed by Brian Whittle.
Thank you, President Officer. I remain Chamber. I am employed by Greater Glasgow and Clyde NHS as a bank nurse. We need to ensure that care and support is available to people on the day they ask for help, no matter where they live. So can the Cabinet Secretary inform me what action is being taken to drive up and ensure consistency and access to treatment across all alcohol and drug partnership areas?
Cabinet Secretary.
Thank you, President Officer. I thank Claire Hawkey for her question. In the National Benchmarking Report that was published by Public Health Scotland, 23 of the 29 areas were assessed as fully implemented for same-day access. That represents 79% of ADP areas fully implemented, and in these areas, 75% of people received their MAT assessment, the first date the service offered for MAT assessment and where treatment can be initiated or, if appropriate, either on the same day of initial presentation or the next day. So we recognise the particular challenges of implementing the standards in rural and island areas and those assessed as provisional green, but I'm pleased to see that there are that these challenges of rurality are being overcome by maximising access and choice through technology, travel and different modes of care.
Brian Whittle, to be followed by Stuart McMillan.
Thank you, Deputy Presiding Officer. In discussing this today, we are discussing mostly around how we're treating those who are caught in addiction. And I wonder if the Scottish Government are looking at the social determinants that have led Scotland to be such an outlier in drug and alcohol deaths. So if you can't identify the problem, how can we properly treat it? So why is Scotland so bad, been so bad for so long?
Cabinet Secretary.
I think Brian Whittle raises a very important point, and one that has been debated not just by politicians but by public health experts as well. There is undoubtedly a very clear correlation between areas of poverty and social deprivation, as well as deindustrialisation and high areas of drug-related deaths. And so we know that the national mission is clearly important in addressing the issues faced by people who have a substance dependency. But the wider work of government to tackle poverty has been the #1 priority of this government, is also critically important, because that then goes to the heart of health inequalities that help to drive some of the issues that we're facing today. But I think Brian Whittle raises a very important issue, and one that we all must consider.
Stuart McMillan, to be followed by Michael Mara.
Thank you, Presiding Officer. I'd like to remind the Chair and also the Chamber that I chair Moving On Inverclyde, a local recovery organisation. Can I ask the Cabinet Secretary for an update on the steps that have been taken to ensure that local accountability in implementing the MAT standards, with a view to driving improvements across Scotland?
Cabinet Secretary.
Thank you, President Officer, and I thank Stuart McMillan for the work that he does locally. Integration authorities for health and social care have a legal responsibility to plan and deliver treatment and recovery services for people who experience drug harms. In June 2023, Ministers issued a letter of direction to NHS Chief Executives, local authority Chief Executives and Chief Officers, requesting that they personally sign a public delivery plan for implementing the standard. These bodies cannot work alone and they must work alongside others through alcohol and drug partnerships to ensure that people receive the integrated services that they need. And following that ministerial letter of direction, the requirement for quarterly progress update reports from local areas against their implementation plans is continuing.
Michael Mara, to be followed by Emma Harper.
Thank you, President Officer. The Cabinet Secretary met with me on 16th of January to discuss the status of MAT standards in Dundee. So he knows already of my concerns that service users and providers in my home city are very sceptical about the continued improvement in these self-assessed reports. Can I ask for the Minister what independent validation of the MAT standards assessments is in place? Because the experience in Dundee, where many of the recommendations of the Dundee Drugs Commission of 2019 remain undelivered, do not tally with the self-assessment that's in front of us today.
Cabinet Secretary.
So these assessments come through Public Health Scotland. I hope that gives Michael Mara some reassurance, though I recognise the concerns that he raised with me and we are following up on some of those points. He also sought clarification on where the government's intention is around what comes after the national mission. And I've set out today my willingness, in fact my desire, to see collaboration across this chamber as well as with local alcohol and drug partnerships and all interested parties on what we do to build from the national mission. Because I think the point that Paul Sweeney made around the work not being complete at the end of the national mission is right. We will still have work to do, and so it's going to be in all of our interest to ensure we work together to agree on what that framework looks like and on the areas that we need to focus in on to ensure that we continue the work to reduce harm and drug-related deaths.
Emma Harper, to be followed by Gillian Mackay.
In November, my office took part in naloxone training with the professional, diligent and caring specialist addictions nurse Ruth McCall. Perhaps if more people who are trained in the use of naloxone, the quicker we can address this and reduce associated stigma. Can the Cabinet Secretary comment further on the uptake of naloxone training across Scotland, particularly in rural areas like D&G, and what further action is being taken to reduce stigma?
Cabinet Secretary.
Thank you, and I thank Emma Harper for taking the time to get herself and our office trained in the use of naloxone. I'd encourage everyone to take that opportunity up as and when they can. Naloxone distribution has been a key priority for this government. We continue to work to ensure it is available to anyone who wants it. Recent statistics from Public Health Scotland show that more than 75% of those at risk of an opioid overdose have been supplied a kit. And I think the question that she poses as a supplementary around the reduction of stigma is absolutely critical. The discussions that I've had with families who have lost a loved one to a drug dependency or indeed are currently living with a family member with a drug dependency point to the reduction in stigma and the ability of people to access treatment as being one of the key areas of improvement that has happened under the national mission, and that can only be a good thing.
Gillian Mackay, to be followed by Audrey Nicholl.
Thank you, Deputy Presiding Officer. The MAT standards are supposed to both drive down deaths and ensure that those with lived and living experience see an improvement in how services are delivered. I welcome the increasing implementation of the standards, but we have to ensure they're actually changing services. How is the Cabinet Secretary ensuring that the feedback from living experience is being taken into account and is used to further drive improvements in service delivery?
Secretary.
I really thank Gillian Mackay for her question, because I think, again referencing back the interactions that I've been fortunate to have with families as well as those with lived and living experience, that making sure we are listening, but not just listening, acting on what they have to say is critically important for us, making sure that we get it right for everyone and that we have a holistic model going forward that meets everybody's needs. And I'd point Gillian Mackay to one example that was already raised by Sandesh Gilhani around the Thistle, where people with lived and living experience were involved in the design of the service. They were involved in interviewing the staff to run the service, and so have been absolutely central. And I believe that has resulted in the early success that we've been able to see, and I hope what will be an ongoing success of the pilot of the Thistle in Glasgow.
Audrey Nicholl, to be followed by Willie Rennie.
Thank you, Presiding Officer. Through my engagement with colleagues working in drug services, I'm aware concerns about access to formal mental health assessment continue, with people often considered too chaotic or using too heavily, and often being passed between mental health services, ultimately struggling to access the care they need. I very much welcome the Cabinet Secretary's recognition of the importance of services adapting and the update on the development of the exemplar protocol. However, I wonder if he can provide any further detail on the action being taken to ensure clear pathways and timescales for mental health support, acknowledging the wider pressures on mental health services.
Cabinet Secretary.
Audrey Nicholl for raising this point, as I recognise it is still a challenge that we need to resolve. I can see that in my own constituency casework, where we have people arriving to health services with both substance dependency and a mental health issue. And so working across mental health and drugs policy, we have commissioned Health and Care Improvement Scotland to produce that exemplar protocol, which builds on best practice from across the country and internationally. It outlines how mental health and substance use services can work together to deliver a whole system approach, which is going to be absolutely critical to fully deliver and implement MAT Standard 9. That work will support local areas to integrate mental health and substance use services and ensure that people with co-occurring conditions can get the help they need, regardless of which service they present at.
Willie Rennie, to be followed by Sue Webber.
I want to ask the Cabinet Secretary about the mother and child recovery houses through the Aberlour Trust that will be provided in the budget, because the Liberal Democrats made the case for that. I want to ask whether the Cabinet Secretary can guarantee that every mother and child that needs access to this service will be able to access it in a location close to their home.
Cabinet Secretary.
Thank Willie Rennie and I thank Liberal Democrat colleagues for their engagement on this. I believe Jenny Minto met with you very recently to discuss this, and I'm hoping to be able to visit Aberlour myself to be able to see the fantastic work that the engagement that the Liberal Democrats have taken to the budget process has helped to deliver, and I'll report back on that in due course.
Sue Webber, to be followed by Rona Mackay.
Thank you. Can the Cabinet Secretary provide some clarity on how the implementation of MAT Standard 2 ensures individuals are fully informed of all recovery options, including abstinence-based treatments, detox and rehab, not just the MAT standards? The Government, as you said, has ambitious rehab targets, yet there are only full rehab 140 beds available for Scotland, not the detox 530 the CabSec referred to earlier in Scotland. So how are these going to be made accessible for all, particularly when financial and geographical barriers exist? And what mechanisms are in place to ensure patient choice is genuinely respected and that MAT is not prioritised over treatment pathways?
Cabinet Secretary. Of the MAT standards, making sure that people have a range of possible treatments. She referenced it, it's MAT Standard 2. We have increased residential rehabilitation capacity to a maximum of 513 beds in 2024. We've reached the target of getting to 1,000 publicly funded places early, and we want to build upon that. But we also have to recognise that abstinence-based programmes are not for everybody, and that we need to also trust clinical judgment in that process as well. So there is, we need to make sure that we invest in all aspects of the national mission. No one element is going to resolve this for us, but we need to make sure that where there is a need and it's assessed as being appropriate, that we do have residential rehabilitation capacity in Scotland. That's what we're investing in.
Rona Mackay, to be followed by Douglas Lumsden.
Thank you, Presiding Officer, and can I apologise for being late to the Chamber. Will the Cabinet Secretary outline the resources that are being provided to recruit, train and retain staff within the ADP workforce?
Cabinet Secretary.
Yes, we have given greater clarity in this budget for alcohol and drug partnerships. We've baselined more of their funding to give greater certainty for their investments. We are also investing in the Cora Foundation to ensure that the work that they do from a community perspective can deliver as well. I'd be happy to write to Rona Mackay with more details on all of that.
Thank you. And finally, Douglas Lumsden.
Thank you, President Officer. Can I ask the Cabinet Secretary how are MAT services working in partnership with residential rehabilitation providers to create seamless pathways from medication-assisted treatment to abstinence-based recovery? And are there established protocols or referral systems in place to facilitate this transition?
Cabinet Secretary.
Those are areas that, as we expand our residential rehabilitation capacity, we also need to make sure that we get clarity and ensure that those pathways are robust. That's part of the building of capacity that we need to deliver, and I'll make sure that I provide greater detail on that to Douglas Lumsden in writing.
Thank you, Cabinet Secretary. That concludes this item of business. There will be a brief pause before we move to the next item of business to allow front benches to change.